Healthcare workers are among those called frontline workers. People who put their lives on the line to care for patients at risk. When serious illnesses take us to hospitals, we look up to nurses and doctors for help. In some cases, it's a matter of life and death. Their selflessness has been applauded in the COVID-19 pandemic, but many health officials are doing so at the risk of death. A Health Ministry and World Health Organization report dated 2nd August 2021 said 13 healthcare workers had died. It had also reported that 4,400 were infected with the virus. These figures have yet to be updated. The Namibian traced the names of 23 health officials who have died due to the virus. Some sources estimate that this figure could be much higher. Some under extreme conditions like basic necessities such as sanitizers, medication, or much needed oxygen to help especially critical patients breathe. A month ago, a photo of 2 health officials seen hugging through a hospital window attracted public sympathy for the heroic work done by nurses, doctors, and support staff. To understand the sacrifices they made, the Namibian looked at the lives of some of the health officials who succumbed to COVID-19. Last year, Aino Kalukambe from Okaku village in the Oshana region marked 30 years of service as a nurse and was looking forward to retirement and spending more time with the family in northern Namibia. Kalukambe, who worked at Oshakati Intermediate Hospital, also had plans to renovate her family house and to travel. But everything came to a halt in March 2020 as COVID-19 started infiltrating Namibia. She responded to a call from the government to assist at hospitals that were beginning to be overwhelmed by coronavirus patients. Kalukambe was happy to go back to work and to do what she loved, helping people. But her decisions exposed her to the deadly virus, and she died in June after contracting COVID-19. Her daughter, Katri Kalukambe, told the Namibian that her mother had never missed work.
I'm a healthcare professional working at Sunday Hospital. In the month of June 2021, I lost the most important person in my life. I lost my best friend, the woman that gave birth to me, my own mother, due to COVID-19. It was really a most devastating time of my life, and I'm still recovering and trying just to heal by the grace of God. My mother was a healthcare professional who served at Oshakati State Hospital for more than 30 years. She was dedicated to her work. She loved her work. She never for a second liked being late. She was hardworking. She never got tired. She loved patients very much. And that inspired me so much to be a doctor. And because of the amount she gave, the sacrifice and the love of her job. My mother was such a beautiful soul. She was very quiet and meek. Everybody would describe her as somebody quiet and somebody very meek. She loves peace. She was just really true to her nature. I miss her greatly, and I wish COVID never came. I don't even know where this virus came from, but we lost precious souls due to COVID.
Christina Shindombe has known Kalukambe since they were 12 years old. They schooled together at Oshakati Primary School in 1972 and later attended the same high school.
My name is Christina Shindombe. I am a nurse by profession. I met the late Miss Aino when I was 12 years old in Oshakati. We were neighbors and we used to play together when we were young. She was a dear friend, very kind-hearted, and a beautiful soul. Our days together were spent with nothing but joy, happiness, and peace. The late Miss Aino was a nurse with a lot of kindness and respect to all patients under her care. She always made time to be available for her patient, and she never gets tired. She had a lot of strength and willpower to take on her task. She was an amazing nurse because she had the quality required when it comes to caretaking of patients. She works until her last day of work, and she was admitted when she was not feeling well. I lost someone so close to me. She was a friend and like a sister. May her soul rest in peace.
Engelbertha Ekanjo's story is quite similar. With just a month to go until she turned 61, Ekanjo from Onaitembu, Ombalantu, too was looking forward to her retirement. She died from coronavirus on the 3rd of July this year. She practiced nursing for 24 years. After 6 years of studying medicine in the Ukraine, Tomona Simata returned to Namibia in November 2016 with the world at her feet. She had met the man of her dreams and they got married in March last year. Known as TK, Simata continued working at the Black Chain Clinic in Windhoek while pregnant with her second child. She then unfortunately contracted the coronavirus and died on the 3rd of July, 2 days after giving birth. 2 weeks earlier, she had celebrated her 31st birthday. Simata was one of the first doctors to be assigned to COVID-19 health facilities by the Ministry of Health.
Good morning. My name is Sarah Elago. I'm the auntie to the late Dr. Tomona Simata. Dr. Tomona, I know her since childhood as a happy child, very full of fun, love, and a child who you want every time to be with. Especially when we're visiting parents or have a family come together. She normally, wherever she is, she's still the show with her funniness and making everybody happy. I've never seen one day Tomona say, no, you don't look good and you don't. Every time she'll tell you, Auntie, you look so beautiful. Auntie, you're so good. And she gives us so much love that is so difficult to know that she will not be among us anymore. Since her childhood, she was like that. And after coming back after the years of study from overseas, she come back as a lady who want to save everybody. And she normally every time teaching us how to take care, especially for myself. She liked to say, Auntie, you need to take care of yourself and that's how you must treat yourself. She come back as a real doctor and somebody who want to save her parents, her whole family. And normally lately we have only meet at the family gathering, and there where she is really everything. You want to be with her all the time. She loved elder people and she loved to take care of them, mostly in the gathering. Yes, she loved her cousins. She loved to come together with the cousins. That's how I know her. And the one thing what I know is saving people was her biggest aim on this earth. The time of COVID in the beginning of 2020, she was the one who was making awareness to everybody. She come around, especially among her cousins. Whenever you talk to them, they keep on saying, Dr. Tomona say that, Dr. Tomona say that. You can see that she was really taking care of them, and they keep on saying, they have said after that, that in their group, she is every time the one who make them aware.
62-year-old Peter Anjala, a former Oshikoto Regional Health Director, died at Ochivarongo's Mediclinic on the 14th of June 2021. Peter's son, Anjala, told the Namibian that his father fought until the end. The two spoke on the 8th of June 2021.
So he went to the isolation room So when he drove, he came the Friday. He drove himself from the north and came on Friday. My mom had prepared the room, put in a lot of fruits and food and all of that in the fridge, put in the kettle, put in all of the little oximeters and all of those things that he might need, extra clothes. And then on Sunday morning, he got ill, and we called the ambulance because he was so weak he could not stand up by himself from the bed. So we called the ambulance, MR24, to come pick him up, and we secured him a bed in Mediclinic. No visitors were allowed, but the ward that my dad was in, there was a window my mom could see inside because he was seated like 2 seats away from the window. He was there in the morning. He was not so okay in the morning. He was very, very fragile, very, very weak. But during the day, he got better. And then in the late afternoon, he was so much okay. Having been a nurse in his early days, his drip got loose, and he himself got himself off the bed and fixed his own drip, put it in the IV cord or whatever you call it. He was there assisting the nurses to help the other people as a director, like you'd always do. So he was there like telling the nurses here, like, no, that one is a bit okay, but help that one first because that one. Monday morning, his situation all of a sudden deteriorated. He was totally disorientated. He didn't quite know where he was. His breathing was not okay at all. And then we started looking for an ICU bed. There was an ICU bed available in Ondangwa. And myself, at the time, they were arranging that, no, they'll take him with an ambulance. And I'm a pilot by profession, so we'll use the aircraft to go airlift him. We'll go from Windhoek and go airlift him from Mochuarongo and take him to Ondangwa. I was busy running around putting together in the morning, secured the aircraft, got a pilot, got all the permits and all of that. And we had arranged with the doctor, and my mom was busy with the doctor in Mochuarongo to sign out that, yes, this patient will be airlifted. So they were busy with those arrangements. And in Ondangwa, there was a doctor who had to get to the ICU bed to secure the bed and to prepare the bed for the COVID patient. So we have been waiting for that doctor to give that confirmation. But in the meantime, his situation really deteriorated. And I called my mom and heard his voice as he was gasping for air, basically suffocating, and it wasn't nice to hear that. So yeah, that happened, and my mom actually watched him take his last breath.
Fresh from Windhoek's National Training Health Center, Shalene Linky Bok started working at the Walvis Bay State Hospital in January this year and did not get a chance to enjoy the fruits of her career. According to her colleagues, Bok died on the 14th of June after being struck down by the virus. Others who succumbed to the virus include Rosa Marie Nikano, who died on the 25th of June at Onanjokwe District Hospital. Nikano worked as a nurse at the Tsumeb State Hospital. According to Superintendent Dr. Akutu Munyika, she left behind a husband and 4 children. The Keetmanshoop District Hospital lost Elsie Jacoba Kisting on the 27th of June. Kisting, who was 60 years old, worked as a nurse. The Swakopmund State Hospital lost 59-year-old Petrina Kulatau, who died in 2020. Kulatau worked as a nurse, the hospital's senior medical officer, Marisha Muton, confirmed to the Namibian. On the 5th of July, Windhoek doctor Johannes van Zyl, who ran a private practice in the capital, also died of COVID-19. Van Zyl was 63. At the height of the pandemic, doctors and nurses braved working at health centers that lacked basic equipment. Some had to let their patients die because they ran out of oxygen.